Innovations in surgeries have been quite incredible. These days, people can receive brain transplants, knee replacements, spinal arrangements, and let's just name it a few. And with the use of technology and robotics, we can assume that advancements in surgeries are only going to continue. But what do we know about surgeries that were performed a long time ago? And we're not talking about last century or even a few hundred years ago. What were the first surgeries ever performed? First, we have to imagine what kind of tools were available, what medical knowledge existed, if any, and what kind of surgeries were actually performed. These first ever surgeries seem to have taken place throughout the Neolithic period. That was from around 10,000 to 4,500 BC. Yeah, that far back. Archaeologists discovered skulls from this period that showed evidence of trepanation, also known as trepanation. This is the process of drilling holes into the skull to relieve any number of ailments. Trepanation is the oldest known form of surgery performed. Skulls with holes that showed that they had been trepaned were found throughout the ancient world, from Europe to Russia and China all the way to North and South America. Greece and Rome also used the trepanning process. In fact, the word itself comes from the Greek trepanon, meaning drill. It was basically an ancient form of neurosurgery. So do people really perform these surgeries? And more importantly, why? People used trepanation for all kinds of reasons. Holes were drilled into skulls to relieve intense pain, such as migraines. Hippocratic texts from ancient Greece recommended drilling into the skull to relieve pus in cases of head injury. Other records show trepanation being used in cases of epilepsy, fever, and even to induce behavior change. But this leads us to less medical-based motivations for the procedure, such as drilling holes to release evil spirits. It's widely believed that the first ancient medicine men practiced on the skulls of animals, such as bears or wolves. Sharp tools were used to tap into the skulls. The ancient Inca civilization soon learned that trepanation was an effective surgical procedure in cases of head injuries in battle or other mishaps. First, the scalp was cleaned gently. Then any of the fragments were picked out from the skull. This more often than not led to the patient's recovery. And the Mayans were also adept at treating head injuries using trepanation. After successfully removing fragments from someone's skull, they would then ensure that the drilling was thoroughly cleaned and the bones were allowed to heal. And a major reason for the high success rate of early trepanations was the knowledge of knowing where, and just importantly, where not to cut a person's skull. These ancient societies were also quick to learn what natural remedies to use for fast and effective healing. For example, the Incas used wild plants such as cocoa and tobacco. Maize beer may have even been used as a painkiller, while plants can act like a soap such as a balsam, were used widely as healing properties in various ancient societies. Trepanation is the oldest known surgical procedure, but there were plenty of other surgeries in earlier times. Ancient Greece and Rome in particular were quick to adopt new innovations and slowly refine their techniques. What's most incredible about early trepanation practices, however, is that the success rates were extraordinarily high. Skulls have been found throughout the world with healed bones in areas surrounding the insertion point. These early treatments of head traumas can actually be proven to have greater success rates than botched attempts in far more recent times, such as the American Civil War and the English-French conflicts. Less successful operations would have surely been intricate procedures such as the removal of cataracts. This would typically mean inserting a sharpened or heated needle into the pierce the eye before removing the cataract. Such a crude method most likely led to further complications like glaucoma. In Greece, doctors would set broken bones and amputate limbs when necessary as well. Evidence from bodies has shown that doctors in Rome and Greece would drain fluid from someone's lungs in other cases. Doctors in various civilizations also performed a typically ancient procedure called bloodletting. Bloodletting involved extracting someone's blood, as it was thought that a blood surplus in the human body could lead to illness. The most basic types of tools used were bronze, silver, or iron scalpels. Eventually, these expanded to rudimentary tweezer-type instruments, as well as forceps and surgical knives. Obviously, with the first surgical procedures, anesthetics were unknown, so the pain factor can only be imagined. If someone bragged now about, how getting a tattoo doesn't hurt, gently remind them of ancient trepanation. There was only very little knowledge of anatomy or physiology too, but this gradually evolved over time. Hippocrates surmised that people's lifestyles would likely affect their health, a view that was widely supported and led to the development of medicines and potions. Also, under the influence of Hippocrates, Greek and Roman societies took on the process of observing, recording, and refining any number of surgical techniques and beliefs. And there are many other examples of early surgical procedures. Egyptian mummies have been found with splints on their limbs. The discovery of primitive forceps suggests open wounds were treated with tools instead of open hands. This was obviously learned from experience, as inferior procedures were replaced with more effective ideas. From India to Greece, Rome, and Egypt, we have evidence of bladder stones being removed. The methods used varied across civilizations, but again, through trial and error, they were gradually refined. Removing bladder stones have been found in Egyptian tombs dating back to 4500 BC. While the success rate of this surgical procedure is likely low, the development of more accurate scalpels seems to have increased the effectiveness of such a delicate operation. Egyptian tombs in general have proven to be extremely useful in enlightening us as to what kinds of surgical procedures were performed. Open-eyed needles have been found, which show that the practice of examining and probing open wounds was commonplace. Mummies have also displayed intricate stitching on their bodies, not unlike the suturing process used in operations today. We can assume that in Egypt and other societies, physicians used suturing to mend wounds after surgeries on common folk and soldiers. India, in another context, was one of the first civilizations to develop plastic surgery. Basic rhinoplasty was used, with flaps of skin taken from the cheek or other body parts. The reasons for facial plastic surgery in those days wasn't so much for vanity, but more to conceal past misdeeds and escape a social stigma. In Indian culture, a criminal or a wrongdoer was sometimes punished by having their nose or ear removed. In order to conceal this evidence from society, the person in question would seek out rhinoplasty surgery. Jumping back to the more medically necessary procedures, nevertheless, some of the earlier civilizations were extremely quick learners and masters at quickly rejigging their surgical techniques. The Mayans were ahead of their time in various surgical procedures, such as setting limbs, stitching wounds, and removing damaged organs. They were also able to perform basic dentistry using a combination of incisor-type tools and a variety of materials, such as fillings for cavities. These included jade, turquoise, and quartz. The earliest surgical procedures are fascinating, not just for the fact that they even existed, but for how they evolved and rapidly improved. While we now live in an age of robot-assisted surgeries, it's hard not to admire the resourcefulness of early civilizations.